Hello everyone, welcome to LAMP's special lecture series featuring tongue diagnosis, third lecture of 4. Today we were going to talk about the tongue body. Examination of tongue body shows the following signs: thin tongue, swollen tongue, long tongue, short tongue, deviated tongue, trembling tongue, rolled tip of the tongue, teeth marks, cracked tongue, swollen sides, and dark sublinguals. A thin tongue points to blood deficiency or deficiency of body fluids, or yin. If a thin tongue body is pale, this points to blood deficiency. If a thin tongue body is reddened, this points to yin deficiency. A swollen tongue points to dampness. If a swollen tongue body is pale, this points to dampness in combination with yang deficiency. If a swollen tongue body is red, this points to dampness in combination with heat. Swellings of the tongue body do not have to afflict the whole tongue body. They can occur partially as well. For example, swollen sides refer to dampness in the liver and gallbladder, while a swollen front third of the tongue points to dampness in the lungs or heart. A long tongue points to heat. A short tongue can point to cold, to heat, as well as to dampness. Cold, heat, and dampness can lead to contraction of the tongue muscles and prevent the tongue to be extended in a normal way. If a short tongue is pale and wet, this points to cold. If a short tongue is red, this points to heat. If a short tongue is swollen, this points to dampness. If the tongue deviates to one side, this points to wind. A trembling tongue as a single sign is not enough for a precise diagnosis. Additional signs are necessary. If a trembling tongue is pale and wet, this points to qi deficiency or yang deficiency. If a trembling tongue is pale and dry, this points to blood deficiency. If a trembling tongue is red and dry, this points to heat causing wind. A tip of the tongue can roll over or under. Both signs point to heat in the heart. If the tip of the tongue rolls over, this points to excess heat. If the tip of the tongue rolls under, this points to deficient heat. Tooth marks point to spleen qi deficiency. Cracks in the tongue point to yin deficiency. The whole tongue can be covered by cracks or only parts of the tongue. The redder the tongue body is, the higher is the heat, caused in combination with the yin deficiency. Cracked at the sides indicates liver yin deficiency. Vertical crack in the area of the stomach reflects stomach yin deficiency. Crack in the area of the lungs represents lung yin deficiency. If the whole tongue is cracked, this indicates yin deficiency in general. In this context, retractions of the tongue body should be mentioned. They are similar to concave dents, where the tongue body is thinner. They point to blood deficiency or beginning yin deficiency. Swollen sides point to liver qi stagnation. Dark sublinguals point to blood stagnation. Let's now proceed to the cases. First, we have the case of a 42-year-old male. The color of the tongue body is red, and this means there's heat. The tongue body shows swollen sides, indicating liver qi stagnation. The thin body at the front would reflect lung yin deficiency and heart yin deficiency. The tongue coating is insignificant. Slight crack in the area of the heart and lungs indicates lung yin deficiency and heart yin deficiency. Besides the reddened body and swollen sides, the crack in the front third attracts attention. Crack and thin body indicates lung and heart yin deficiency. The yin of the kidneys, lungs, and heart should be tonified and the qi of the liver moved. Then we have the second case, 50-year-old male. The tongue body is red in the front third. This represents heart fire, heat in the lungs. The tongue body is partially swollen, especially at the root. So there is dampness in the lower burner. We observe the yellowish tongue coating in the middle and posterior third. Thus, this would mean phlegm heat in the lower burner and phlegm heat in the stomach. Note the deep horizontal and vertical cracks in the middle. This reflects stomach yin deficiency. Treatment principle, therefore, should be to expel the phlegm and heat from the stomach and spleen and from the lower burner. Following it has to be discussed whether signs of the yin deficiency are significant. If so, one has to tonify the stomach yin. Next, we have the tongue of a 43-year-old female. Color of the tongue body is red, so there is heat. Tongue body is swollen and reddened sides. This is liver qi stagnation with liver fire. If you look at the tongue coating, it is yellowish and slimy in the middle part. So there is phlegm heat in the stomach. We notice the deep crack in the middle as well. This reflects stomach yin deficiency. Obviously, we have the tongue which represents phlegm, heat, and yin deficiency. Phlegm is predominantly located at the middle of the tongue, so there is phlegm heat in the stomach. Therefore, phlegm and heat have to be expelled. The whole tongue body is red combined with the vertical crack. So, there is heat caused by kidney yin deficiency. This must be examined precisely. Liver qi stagnation plays an essential role in the development of heat. Next, we look at the tongue of a 40-year-old female. Color of the tongue body is not significant because it's pale red. Tongue body is slightly swollen, pointing to dampness. Notice the yellowish tongue coating at the middle and posterior third. This would indicate phlegm heat, dampness and heat in the spleen, and dampness and heat in the lower burner. Take note also of the yellowish coating at the left side, and this indicates dampness and heat in the liver and gallbladder. There is no coating at the tip of the tongue and at the right side. So there is heart yin deficiency, liver yin deficiency. Note the vertical crack at the middle and posterior third. This indicates kidney yin deficiency, stomach yin deficiency. Remember that kidney yin deficiency rarely exists alone. Phlegm, heat, and yin deficiency are the signs that we see on this tongue. And so the phlegm from the liver, gallbladder, stomach, spleen, lower burner has to be dispelled. At the same time, we need to also tonify the yin of the kidneys and the stomach. Tongue number 5 belongs to a 72-year-old male. Color of the tongue body is red, representing heat, and the tongue body is thin at the front third. Lung yin deficiency, heart yin deficiency. Mainly, we don't see any coating, so there is yin deficiency. And we notice a white streak, which means phlegm. And we describe this as a furrowed tongue, which is very indicative of yin deficiency. The furrowed and thin tongue body indicates that yin deficiency has been existing for quite some time, and the affected organs are the lungs, stomach, and kidneys. The whole tongue looks wasted, and phlegm is another problem. So the treatment principle would be tonifying the yin and dispelling the phlegm. Tongue number 6 is that of a 31-year-old female. Color is pale and dry, so this is really blood deficiency. And if you look at the tongue body, we notice a divided tip of the tongue. This is heart yin deficiency. The sides are swollen, very indicative of liver qi stagnation, and the deviated tongue tells us a lot about wind. Now, we notice a slightly thick coating at the middle of the tongue. This indicates phlegm in the stomach or spleen. Swollen sides clearly indicate liver qi stagnation, probably caused by emotional disorder. If we remove the liver qi stagnation, we expect the phlegm in the middle to be possibly removed as well. The yin deficiency in the heart has to be tonified as well. Thank you very much for your attention.